Hello everyone, we are the Typhoid Fever Symptoms and Transmission Group.
Hi, I'm Samantha Harris.
Hi, I'm Jafar Shakara.
Hi, I'm Maria.
Hi, I'm Aiden Horsad.
Hi, I'm Kayla Greenwood.
Hey, my name is Sam.
Typhoid is a disease that is relevant to larger societies like Nigeria as it contaminates water sources and everyday food supplies. In this presentation, we will go over the causes and transmissions, the common symptoms, high-risk areas, and the impact on health and society.
Causes and transmission. Typhoid fever is the spread of Salmonella typhi, which is a bacteria. What are some primary causes of the spread of typhoid fever are contaminated water and food. A primary cause of transmission for children is drinking unsanitary water. What are various modes of transmission? It could be hand-to-mouth contact through stool, flies, unsanitary water, unclean food, and flies. How is natural vegetation affected? So when you have the vegetation out in the fields, many flies carrying the disease can hop onto the vegetables, and if it's not washed prior to eating, then you will pretty much eat the disease, eat the bacteria, and the same thing happens with drinking unsanitary water. You will drink the bacteria, and then once it's in, there's really nothing you can do, but except take medication. An ecological factor affecting the impact of spreading typhoid fever is that Nigeria right now is experiencing many severe weather events that bring rain. So when this rain comes, little floods form, and flies come, or if there's stool, flies will come and carry the disease and start biting other people, and that's a major problem right now too.
So, the common symptoms of typhoid. So, our image, we are showing one of the major ones, and it's a good indication that you have typhoid. It is rose spots. So, common symptoms such as rose spots, fevers, headaches, abdominal pain, a loss of appetite, and abdominal pain. When the typhoid fever, person that contracts the fever, there's a 3-week stage. In the first week, it is just a general body weakness and a gradual starting rising fever. In our second week, this is when the rose spots start to occur around the bodies, and usually around the back and the arms. In the second week, it's usually when the liver and the spleen are slowed, and this is when the liver and spleen enlarge. So in the third state, this is the typhoid state. This is when the toxin enters the bloodstream of the patient, and then this is when they go into a coma. Rose spots, as shown as our photo on the right, or the left, have a rash-like appearance. Many patients won't expect this to be typhoid or rose spots and will just think that it's just a common rash. This then leads them to not go and seek medical attention. What these rose spots do is they mimic meningitis, confusion, and delirium. So it's a major problem when there's a lack of information, a lack of knowledge toward the subject. So the severity and the progression of this disease. If typhoid is left untreated, it can cause many damages inside the body. This can go into intestinal bleeding, organ damage, or death. The diagnostic challenges of typhoid fever is that typhoid is a disease in Africa, but it is also very similar to other tropical diseases such as malaria. This can create problems for the doctors and those who are trying to diagnose this in a clinic.
So let's talk about some of the risk factors, that is, the conditions that make an individual more vulnerable to infection rates or more severe symptoms. The first thing to note here is the socioeconomic statuses of individuals and the severe and significant negative relationship it has with how individuals are prone to typhoid fever. Specifically, the things like crowdedness in housing, limited access to proper sanitary environments and facilities, unsafe drinking water, as well as unsafe foods, tend to lead to very detrimental impacts. But also interestingly, we found that areas where land and soil is often irrigated with feces are also extremely vulnerable to infection, and these individuals are extremely vulnerable to these severe symptoms. I think this is because feces is one of the major primary infectants of contaminants of the Salmonella bacterium, and this is important to know in the Nigerian context, given that a lot of cultural and agricultural practices often involve feces in irrigation. And cultural norms also affect Nigerians as well as bad practices. So things like religion and belief in traditional remedies as opposed to doctors and in proper hospital settings. Family also have hesitancies over vaccines as they're worried will cause their children to become infertile and other assorted events like that. If we scope out on a broader scale, a general lack of information with regards to what typhoid fever is, how it spreads, also leads to a lot of detrimental implications, such as negative health, bad hand washing hygienes, as well as bad hygienes when eating. So the results are often individuals eating with their dirty hands, drinking dirty water, without consideration of the bacteria that could be within their foods. And additionally, there's a couple of vulnerable groups to note here. Firstly, the individuals from ages of 5 to 19, where their immunities are extremely weak as they're not developed, and as well as similarly, people with immune disorders, where they're often experiencing very severe implications of typhoid fever. And last interesting to note here is that the gender impact here. Males are often more affected than females by typhoid fever. This is often due to worse hygiene practices. And then the last thing, there's some environmental implications here. In the months between July and September, we find that individuals are extremely prone to infection. This is likely due to the increased rainfall, leading to higher transmission rates, the increased water that makes transmission more likely, as well as the elevated temperatures, which makes bacterial growth more likely as well.
So on to the topic of individual health and public health, children are often the cornerstone of society. Because of their youth, they are often simple-minded and they often tend to their parents for guidance. In several northern Nigerian schools, public schools, children attend the public schools that have small communal and unsanitary areas. And because of this, bacteria seeps through those areas and can contaminate the children. And children unknowingly attract typhoid due to the lack of education and as well as resources. And so when parents are informed of the bacterial infection that has contaminated their children, they often try to make those ends meet and provide the best preeminent care for the children. However, due to limited transportation, which is a big public health complication, they often cannot. And so in these cases, parents tend to bring their children to primary and secondary care facilities that focus on general and complicated care. And so not only does this impact the parent who is paying for the care, but it also puts pressure on the healthcare workers. For children, especially with typhoid fever, they present a lot of complications. And children need a lot of adequate care. And so for the doctor-to-patient ratio to be 1 to 600, there are several healthcare professionals that are not present, which means that there is a lack of adequate human resource. And so the doctors that step in are often untrained or cannot give the best quality care than the doctors who are working. And with all that combined, it also contributes to the lower life expectancy of children. And because of financial literacy, which is a large struggle in Nigeria, there is a disruption in community. Theft, corruption, and lack of honesty are common cases of criminal infrastructure that is also deteriorating the healthcare facility. And because of this, doctors often feel like they cannot enter their healthcare facilities, they often feel unsafe, and that is all contributing to the public health, the individual health of children, because they are not given the adequate care. So overall, when a disease outbreak impacts the entire community, everybody is impacted.
Okay, so our community workshops are focused on the subtopic of symptoms and transmissions. We're focusing on the ages
5 through 9, because like Kayla said, they're the most impacted group because of unsanitary schools. So we made a couple of kind of kiddie games, one being foodborne foes, and the other being a comic book.
The first exercise of our workshop will use fake vegetables and glitter to teach children how to properly wash their hands and their food. The instructors of this workshop will secretly sprinkle glitter onto these plastic vegetables and instruct the children to make plates of food. The children will be unknowingly spreading the glitter, which represents the bacteria, and then the instructor will tell them about the glitter. They will learn how easily that bacteria spreads in food, and after the kids will properly wash their hands and the food.
The second activity that the children will partake in is reading a comic book about typhoid. So we have created a 3-page panel that undergoes the transmissions and symptoms of typhoid using a lot of visuals, graphics, and beautiful characters.
Alright, so on our 2 workshops, we spent a total of $303 just on the plastic vegetables, paper plates, glitter, comic book paper, and our posters. With the remaining $200 that we have left over, we are going to be donating it to local schools so they can improve the cleanliness of the bathrooms for children to use.
Yeah, and here's our 2 handouts. We really aim to create vibrant colors and leave profound impressions on individuals. Here's our first posters on typhoid symptoms. So as listed, here are the 5 most common symptoms here, and these will be handed out in hospitals, in these activities, to the parents, to the children, and they're aimed at a lot of the people that are affected by typhoid fever.
Thank you. These are our resources.